Thursday, and we're going live. Welcome to an episode of Rackspace Live, everybody. I want to show you a fancy graphic for it, even too. Come on now. All right, everyone. I do want to welcome you to a Thursday edition of our live show, and my name is Jeff DeVerter. I am the Chief Technology Evangelist for us here at Rackspace Technology and healthcare. Folks, technology is taking over healthcare. There's so much opportunity. But as we get into this conversation today, well, we want it to be just that. I brought along a couple of guests, but they also want to be able to hear from you. And the way we start that is by you introducing yourselves. Tell us who you are, tell us where you are. And if you want to get a hold of us, easiest way to find me is just to send an email to solve@rackspace.com. Hey, Niraj, glad that you are here. Thanks for joining us this midday. Well, depending on where you are, it's midday for me here on this awesome pre-Friday. Now, the topic, as I mentioned, that we've got here today is all around healthcare. And to start that off, what I thought I would do is have a little conversation about an article that I was able to find. Hey, Aravind, glad that you are here. Nice big hi to you as well. But let's take a look at this. So there was an article that I found, and it was "The future of healthcare is in the cloud, but is it public, private, or both?" Now, in this article, it talks about all the pluses and the minuses of when and where, public or private might fit, and ultimately gets to the point that the catch line is it really is in both. And it's too complex of a conversation really to have a binary answer. Because there is no one answer to this. In transparency, there's no one answer to public or private for any of our organizations either. And what that ultimately drives us towards is conversations. How do we understand what are those driving requirements? Where are we trying to get? Now, we've got Jan here from Dallas. You are senior principal with Forian. Glad that you're here, Janice. We also have Giovanni. Glad that you're here from California. Brennan from Scottsdale. Everyone is just kind of coming on in. A U.S.-centric audience today. Normally, when we go live, we in the mornings, we get a lot of folks who are more international. I guess our friends in India and the UK maybe have gone to sleep for the day, or at least gone to the pub. Well,
Yeah, so it looks like there were some issues, but maybe PV, thanks for joining. I'll maybe start off by talking about why is there so much interest in healthcare, right? I mean, why is there a lot of traction in the market? Look, I think today it's we are in this is the most entrepreneurial age in healthcare, right? We are seeing an unprecedented change in healthcare, and I look at it from three different trends, right? Number one, the most important of which is we are fundamentally changing how we pay for healthcare in America, right? This is changing what the providers and the health systems are looking for in their tech-enabled solutions. For example, it used to be doctors would submit a bill for the services that they would document laboriously into the record, hoping to get paid. We are now moving from documenting and billing to the population at large. For instance, who are the folks, right, who are not coming to the clinics? So if we can focus on them, we can perhaps reduce an unnecessary trip to the hospital. The first step is to reward those providers. And I think Rackspace, we can talk about that, but we play an important role in the analytics around that space, right? Now, to focus on which patients to look at, the government has opened up unprecedented amounts of information, right? Both patient data as well as macro level data for folks that want to make sense of this so that we can exchange that information better, right? And last but not the least, what was previously in Manila folders is now being exposed at discrete pieces of data that can now fuel connected apps, right? And that's the whole thing around FIRE. So I think these three trends, the opening up of data, the interoperability of records, as well as the changing of payments, makes this the most entrepreneurial time, right? What's changing now, I think, is we are seeing for the first time what was previously in these folders and in digital formats being exposed as discrete pieces of data that can now fuel connected apps. And that's kind of what is really driving this age of healthcare. And we'll touch on a lot of that, but love to hear your thoughts as well on what Rackspace is doing.
Absolutely, Vinesh. And good morning, good afternoon, and thank you so much for making it convenient. I see Jeff is sort of offline, but hey, we'll get the conversation going. And we see some SOC analysts from Vancouver, so glad to have you all join. And before we dive into this topic, Vinesh, let's introduce ourselves, right? So it's important. So how about you go and introduce yourself, and then I'll introduce myself and get into the topics.
Absolutely, PV. So my name is Vinesh. I'm actually a new racker. That's what we are called here at Rackspace. I joined about a few months ago. Been working in healthcare for all my life, and managing the cost and quality of care. Uh, Previous to Rackspace, I was the CIO of Lumeris, which is a population health company, focused on driving outcomes and reducing cost, right, in terms of pop health. So that's a quick overview of myself.
Thanks, Vinesh. And I'm PV SubbaRao. I'm responsible for enterprise business at Rackspace for Americas. And I also lead our healthcare go-to-market strategy and execution for various segments of healthcare. So I got a digital view of what healthcare means for Rackspace, and perhaps if we can sort of like present that, so that sort of paints a picture as to what healthcare means for us. Essentially, the way we look at it is healthcare is a five segment view of the entire ecosystem, and we see payers and we see providers. So there is more of a pay wider type of an alignment that we see in the marketplace, and we have life sciences. Life sciences is a combination of med devices and pharmaceuticals, and we also have a fifth segment, which is HIT, health IT, more of the SaaS players, and that look at how technology can create new forms of value. And it's sort of important for us to recognize all five segments of healthcare, and interesting times to be associated with all five segments.
Absolutely, PB. And I think, as we know, COVID has changed a lot of that, right? As I say, as the Sputnik set off the space age, COVID has sparked off the digital health age, right? So we are seeing a lot of adoption in the cloud, and a lot of changes that are happening, across both public and private cloud. Would love to get your take on, some of our, offerings, right? For example, the imaging, as well as some of the other pieces from an Epic standpoint. Love to maybe it'll help our audience to kind of think through where we are going and see how we can help. So.
Sure. At a macro level, COVID has triggered more of the pace at which you can disrupt and or bring change into the environment that you are surrounded with. So the pace and then the change that you are looking at is to drive what are the new ways of working, and how do I drive more digital consumer engagement, and how do I drive more productivity and value for the organization, and how do I handle cost management much more effectively. So these are sort of macro level CXO priorities for almost every firm. And when you look at what we are seeing as a service type of model, and cloud is front and center of how we look at it. And Jeff sort of presented, hey, what are you seeing, public, private, or both? And that's essentially where we are. So multi-cloud is real, and we see how customers are looking at in leveraging both public and private in a manner that actually drives much more tighter alignment towards what they can do more with less. So specifically, what we are seeing in the healthcare space is how do I rationalize my application ecosystem, both clinical, non-clinical, and drive this more of as a service consumption. And we also look at what is my EMR as a service and what can be done in a public and private cloud ecosystem. There is so much happening in both sides of the world, and we are super excited to be front and center of it. The second thing is, if you look at more of the radiology, cardiology, and mammography studies from large images that you may have in the clinical ecosystem, how do you drive efficiency in terms of image as a service? So that's also another thing that we are looking at. And you talked about interoperability and fire integrations, and everyone is talking about for long HIEs. So they're all sort of coming in terms of how you leverage data and use the data as an advantage. End of the day, most of the organizations are seeing data as an asset for them. And what do they do with? So what do they do with it? So do they do more about how do I create as future analytics, or how do I leverage for not just as an opportunity for driving additional value, but how do I convert my cost centers into profit centers? So interesting trends that we are seeing.
Absolutely, PV. I was reading some important statistics just on imaging. I was reading about radiology, and how in a 12-hour shift, and we are looking at now today 50,000 images, right? Just 10 years ago, it was only 500 images. See, the other statistic was 40 million medical errors occur, right? So about 350,000 errors are deaths because of these errors. And I think the space that we are in from an imaging standpoint, specifically around reducing latency, we have an unfair advantage in that area, because now we are able to serve up those images, but also leverage AI, to then, for example, we can now focus on things like pneumothorax, to be able to diagnose those early, because as that's the number one cause of death, right, in hospitals. So to put AI and imaging. So it's not that, AI is going to replace the doctor, but the doctor who are going to use AI are going to replace those who don't, right? So that's kind of where, I think it's an interesting conversation in that imaging radiology space.
Okay, you guys did a fantastic job tap dancing while my computer blue screened away. I'm just enjoying listening to the conversation, but I wanted to jump in, Vinesh, on that, because you talk about how AI is not going to replace the doctor, but really becomes this, I would call it that I'll call it the exoskeleton of extra power. So one, how do you get rid of the haystack so that you can see the needle of maybe where a problem exists? Or on the flip side of that, once the doctor makes the diagnosis, can the AI then go back in and substantiate that and make sure that that it's correct, find other corroborating evidence that might go along with that, and also give some insight into other treatment plans and things like that.
Yeah, great point, Jeff. Right. I mean, the example I was using around pneumothorax, that's the collapsed lung, by the way.
Yeah.
What happens there is today it takes 8 hours before an image goes to a radiologist. In 8 hours, within that period, it could cause a death, right? So it's pretty
You
serious.
sort of need your lungs. The lungs are sort of important on a moment by moment basis.
Exactly. Right. So from that perspective, now AI can actually because it's pretty easy to diagnose a collapsed lung, right, for doctors. Yeah. So now AI can just flag those images, and now the technician can serve those images to the PACS system, right, instead of waiting for 8 hours. I mean, this is real, right? So we have technology saving lives, folks, and that's why this is such an interesting space, and why we are so bullish in that area.
Well, in PV, as we think about all this crazy new stuff and ways of using the technology, then you look at how do you have companies to help support that. Now, Vinesh was on the live stream last week, and in that conversation, we talked about how even our phones are these medically capable devices, and IoT at the edge really helping to capture data. But at some point, we have to manage all of this data. So when we think about Rackspace, where does Rackspace fit into that? Are we at the edge, coming up with the latest Apple? That's not an Apple Watch, but pretend it is, a capability, or are we helping to manage those larger systems to help aggregate and manage that data?
So data is a huge topic, Jeff. So if you really see it, how do you look at one is to sort of, hey, it's an asset for me. How do I convert that asset into more of value? of how am I consuming internally and how do I commercialize. So there are aspects of so what next. So one is to sort of drive some insights from data. So we have data analytics practice that really drive forward-looking analytics as well as retrospective analytics. We have our own platform offering in terms of, hey, how do I really use this data? Not just about like every initiative, but in a manner that I can use this platform that accelerates the ability for us to discover insights. Very, very important. And the second thing is that how it can drive some core initiatives for customers. For example, we talked about more of the image data, radiology, cardiology data. If you take the data and sort of archive it, but if you were to apply AI, ML on top of this medical image data, how can it drive insights that can shape your population health strategy is very, very important. And then that's where I see not just about like, hey, cosplay, hey, how do I store this particular huge base of my studies at a lower cost, while that is important, but and the customers are looking at how do I take data insights and shape my overall strategy of what I'm trying to address in the marketplace. So absolutely important. It's more like a value based model. I think Shankar was talking about it. It's a value based model that is super critical, not just pure cost play.
No, that's a great point. And by the way, hi to Shankar and Sean. I mean, this is great timing. The comments are coming right at the time of of data, right? And I think, look, we are moving from a model where we refer a patient and we'll deal with them to having more accurate information in terms of eligibility checking, encounter processing, authorizations. So moving from this fee for service, today we are in this twilight zone between fee for service and value based care. And the models of the data model that we are working on, Jeff, is taking all these processes that exist in healthcare today, right? Claims processing, payment processing, enrollment, authorizations. These processes, they are very disjointed. So we want to be able to take these processes and make them work off a single framework, right? Have control over that information, manage that information, and then have access. It's not just about managing it, it's having access to that information to then leverage the performance of our business. So we are bullish on that. We're looking at that whole data lake strategy. We're helping a number of clients, both on the health system as well as the payer side. So just wanted to add that color. And then the unified patient record, I mean, that is key, right? Because today, one of the reasons for disjoint in healthcare is that, we are siloed to the four walls of the clinic, right? So how do we now move to that longitudinal 360-degree view is something I think Sean has pointed out very, very correctly there in the chat.
So Jeff, one point I wanted to add. So our recent acquisition of Just Analytics, right, that you're familiar, is a key testament to how we are accelerating this journey into the marketplace. And the platform that Just Analytics brings to the table is super instrumental in accelerating the journey of what the customers are looking for. And again, finding needle in a haystack, the word that you used. How quickly can you do it is important, and that's where we play a key role.
That's interesting. So there's one other key topic I think we should talk about, and that is as we think about bringing together this data to create more actionable insights and ultimately not just driving businesses better, but driving better healthcare. Is you have to think about cybersecurity and about ransomware. Because the more of this stuff you bring together, you think, great, it's all together, but am I exposing myself for a singular attack? What are some strategies? How are we handling that? Maybe Vinesh, you take that first as we think about the industry at large, and then PV, maybe what we're up to at Rackspace.
Yeah, from a cybersecurity standpoint, look, we are leveraging our public and private clouds to be able to, make sure that we are compliant with HIPAA. PHI is extremely important, right? So we are focused on, protecting PHI, right? And then a lot of that on the public health, public cloud space is out of the box, but we are really, kind of laser focused on the cybersecurity aspects as well. As we build this data lake platform, that is a key component of our strategy.
So Jeff, I will try to see this from the lens of where is most of the source of ransomware that one should be careful about in healthcare ecosystem. So the perimeter security is pretty much most of enterprises have taken care of, right? So it's the basic blocking, tackling type of measures are already in place for almost every organization. But that said, there are two aspects that I see to be much more critical. Number one, the clinical world of how the care delivery settings are positioned today, and that in relation to med devices. So, are you sure that each of your med device is fully in control with respect to med device security and the standards that one has to really adhere? That's very, very important. And most of ransomware attacks, and that I'm familiar, so in fact, it is public news as well, that an easy entry for anybody to penetrate is through med device security, right? So there are gaps in terms of med device posture in the clinical world. The second thing is that there is so much, you talked about wearables and IoT and new devices that are proliferating in the marketplace, and that's actually bringing much more. So this particular world is something that we will have to be much more thoughtful as to how we look at compliance, which is very, very instrumental and critical for us. Not just compliance as a adherence, but also policy making that has to come into play with it, because there is a personalized medicine as an initiative that is driving a lot more innovation in med devices and pharma world. Very, very important for us to pay attention to, and how quickly can we be agile in making sure that we are adaptive to what the new standards are going to be.
Well, folks, hopefully one of the things you're picking up on is that any innovation that happens in and around this area isn't just about the tech. It is, of course, about how it impacts the business, but most importantly, it's also about how it impacts the end patient, the patient care. And but there's so much compliance, there's so much rigor that's built around that. Now, as we do these events here, live talking to you, you're engaging with us. We have our Cloud Talk Live, which is about thought leadership, where we're helping to bring information to the world that'll help make your day a little bit better, make you a little bit smarter. Well, we do tend to do these here on these Rackspace live events. We're also here to tell you we're really pretty good about with this in this marketplace and in this space, and the practice that is established and that we're refining and being even stronger is one designed to help make sure that all of those areas are covered. And PV, maybe in our last few minutes, you can just talk about how people can get engaged or find out more information about how Rackspace specifically might be able to help their organizations.
Sure, Jeff. We cover ourselves across various segments, and for us is like not just specific size and scale of how we serve across all five segments that we talked about. And we look at it when a customer is in or anybody that is in cross juncture to decide what's my choice. You post one topic, public, private, what's my choice, what can I do. Cloud is driving a lot more in terms of what can I do more with less, and we play a key role in terms of how we can help them in doing a quick assessment, and also come out with some creative ways of driving all of your technology choices, and which is basically your infrastructure, your hardware, your software, your services, everything as a service kind of format, with a clear value proposition of making sure that you get the best value for your investment. And we cover that across commercial, mid-market, and enterprise. And you can reach out to any of us for where and how we can help. And we are different compared to rest of the other ecosystem in a manner where you get to see the depth and breadth in each of these areas, which is very, very important for you to drive faster, quicker, the pace at which you can drive innovation.
Yeah, and before we slip away, Vinesh, is there anything you might have to share about what Robert posted in there, either about easing the learning curve or his the comment about EMR?
Yeah, I think if I'm reading the question, he's saying it's my observation that EMR is tied too much to billing, right? And I think I agree with that. But we have an opportunity. We talked about data lakes, right? But we have an opportunity to take that information, right? To take that data to convert it into information, but to also then convert it to clinical utility, right? So there is a lot of extremely important information in these systems, like clinical notes, right, that can be used or leveraged to basically prevent, right? So prevent something from happening, right? And we talked about it last time, is to really, the bigger opportunity is to move us from what we practice today, which is sick care, to true healthcare, which is continuous and proactive, right? So I think that's an important question. I think it will be a longer answer if I have to, but I'd love to address that question, Robert. You can ping me, and we can discuss. This is something that's near and dear to us.
Yeah, and this is one of the things I think really sets us apart is the fact that, folks, you can find us on LinkedIn. You can ask us questions. We will respond to your questions. But for now, we do have meetings, everybody, at the top of the hour. And so we are very appreciative of the fact that you were part of this conversation today. We will be back to continue this as the weeks and months continue. So you can expect to see PV and Vinesh coming back to talk more about what's happening in healthcare and technology. But for now, guys, we're going to close this one up. Thank you so much for engaging, and thank you for enduring while my computer decided to blue screen. So have a great afternoon, and we'll hope to see you next time around. Have a great day, everybody.